Hi, this is Jessica, and I'm going to be doing my NG insertion, irrigation, and removal skills video. Scan the room for you. Alright, set up the computer. My patient. You can see that alright. Alright. I'm going to start by explaining the procedure to my patient, let them know what I'm going to be doing. Then I am going to check and see which nostril I'm going to be putting it in. I'm going to ask my patient if they've had any past surgeries on their nose, deviated septum, polyps, anything like that. Checking either side. I'm going to pick this one closest to me. It'd be a better angle for me to do this at. Now I'm going to take my tubing and I'm going to measure it for my patient. I'm going to take it from the tip of the nose to the tip of the earlobe down to the xiphoid process. And I'm going to put a piece of tape and mark where it's at. I'm going to coil my tubing a little bit, get it so it goes in at a good angle. Okay, looks good. Now I'm going to take my lubrication and go 3 to 4 inches. Alright, now I'm going to start putting it into my patient. I'm going to go in, and if they start gagging, I'm going to stop, give them a little break. There's some water over here. Give them a drink of water. It'd be nice to have an assistant to have the patient take drinks of water while you continue going down with the tubing. It just helps it go down easier. So if I had an assistant, I'd have them take a drink and I'd have them swallow as I'm putting this in. So I'm going to have them swallow, 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 and swallow. Alright, we got it in. I'm going to take a piece of tape and secure it to the bridge of the nose while I do my checks. Okay, now I'm going to do my checks to make sure my placement is right. And also while I'm doing this, I'm going to have Kleenexes and an emesis basin in case there's any emesis that may come up while I'm putting it in. Check the placement now. I'm going to take my syringe, put in 5 to 10 cc's of air into the clear side, making sure I hear that swoosh. Alright. Now I'm going to aspirate 5 to 10 cc's out of stomach content. I'm going to coil my tubing, take that stomach content. I'm going to test the pH of it, make sure it's from 0 to 4, so then I know that I'm in the stomach. Alright, now I'm going to take this and I'm going to hook it up to my suctioning. So I hook up my suctioning. Now I'd secure this on the nose a little bit better. Alright, once I got that hooked up, I got my suction hooked up. Now I'm going to take again 5 to 10 cc's of air with a different syringe. And I'm going to go into the blue tube this time. And I'm going to put in the air to get it away from the lining of the stomach. Alright, did that. Alright, that all looks good. Now I'm going to attach the tube to the gown. Give them little leeway here so they can move their head a little bit from side to side. So that's done. Everything looks good. Now I'm going to come back later, do a check on my patient. I notice that their stomach is distended. I'm not seeing anything in the suction cup. So I'm going to turn off I suction, turn it off from low. And then I'm going to take this off, and again I'm going to put in that 5 to 10 cc's of air. I'm going to listen for that swoosh, see if it's in the right spot. So I put it in, I can't get the air through, I'm not hearing any swoosh, so I know it needs to be irrigated. I'm going to take that out, I'm going to put in my plug, and I'm going to take 30 cc's of water. So I'm going to get my water. Alright, I got my 30 cc's of water. I'm going to go in on the clear side, and I'm going to pump to try and get whatever is blocking through. I'm going to hold on really tight right here, and I'm going to pump it until I can get it through. And there I got it through, so I've got it irrigated. So now I'm going to take my suction again, I'm going to hook it up to my suction, turn it on low. Now I'm going to take again that 5 to 10 cc's of air, put it in the blue, get it off the lining of the stomach. Alright, and that all looks good. Now I'm going to come back a few days later. I've gotten an order to remove the NG tube per doctor. So I'm going to come in and explain what I'm going to be doing. I'm going to start by listening to my patient's bowel sounds, make sure everything's active. So I'm going to listen in all 4 quadrants. Alright. Excuse me. Then I'm going to unhook my suction, and I'm going to put in that 5 to 10 cc's of air, and I'm going to listen to make sure I hear that swoosh. I put in the air. Alright. I'm going to take that off, and I'm going to, we're not going to take it off actually, I got to aspirate the stomach content. So I'm getting 5 to 10 cc's of stomach content. I'm going to check the pH of it again, looking for 0 to 4, making sure I'm still in the stomach. Once I do that, I'm going to take a clean syringe, put a plug in this, take a different clean syringe. I'm going to put in 20 cc's of water and 20 cc's of air, so I can clean out the tubing, so we can discontinue it. I'm going to get water, I'm going to get air, I'm going to go in on the clear side, and I'm going to put in, tip it up right, I'm going to put in the 20 cc's of water, and then the 20 cc's of air, and I'm going to leave this in. I'm not going to take this out, I'm just going to lay it on my patient's stomach. Now I'm going to take it out of the nose. So I'm going to remove the tape here from the bridge of the nose, holding on to my tubing. And now I'm going to do a hand over hand removal. I'm going to tell my patient to take a deep breath and hold it while I do this. And say take a deep breath and hold. And then I'm going to go hand over hand and remove this. Okay. Got that. I'm going to take this, throw this away. Then I'm going to perform good oral cares on my patient. Make sure I get everything out of their mouth. Make sure they're alright. And now I'm going to document everything I did, make a dark note, state if I had any trouble or anything with it, and that's it.